Good morning, everybody. I am so excited for my guest today. This is the first live that I've done with outside of the studio. So I'm doing this here at Dr. Elmer's office. I am so glad that you let me come here today. I met Dr. Elmer at a ladies' lunch and learn that I go to on Tuesdays. And when I saw what he did and when he spoke, I was just in awe of the work that he does. It's amazing. He's helped many friends of mine. I was explaining to Dr. Elmer, when I've tried to explain who he is, people don't really grasp who he is or what he does until they actually see him. And I was telling Dr. Elmer that every single person I've ever invited to a class or to Joan's house, they call me the next day and they're like, I cannot believe how amazing that this man is. So I want to introduce to you Dr. Roger Elmer. He is with Advanced Neurospinal Solutions and Autistic Spectrum Solutions. He is on another level of amazing, and I'm going to call you amazing because I think you're amazing. Can you tell them about how you got started? Because first you're a chiropractor, then you went to college. So will you share with them how that story?
Yeah, originally I wanted to be a physical therapist, and I realized that I went and volunteered to do physical therapy work, and I had nightmares there. Nobody got well. Of course, I was working in a burn unit at the time, volunteering there, and I couldn't sleep. I couldn't think. I said, this is not for me. And I happened to get injured. I was an athlete in college, and I got injured, and I happened to get taken care of by a chiropractor, which I'd used chiropractic off and on as an athlete, but it was just a short-term thing, and this guy put me back together, and because I couldn't even get out of bed, there I was, 250 pounds, and friends of mine couldn't get me out of bed. And so I thought, well, maybe I can be a chiropractor. I can do things for people that other doctors can't do, and a different approach. And so I finished up the schooling I needed, went off to chiropractic school. It took a total of 10 years to get through that curriculum, and I had been doing it for quite some time. And I found that I wasn't getting people truly well. I would get them out of pain, and I was good at that. I had some pretty cool little tricks to decrease their pain, but then they would be back in 6 months to a year, and not only were they back in pain, sometimes they were worse, but the worst thing was I'd take re-x-rays and they were worse, degenerative wise. The mechanics had broken down of their body, and I had tried to take care of patients. Of course, they teach you in school that you can fix spines, and so I'd take care of patients, get them out of pain. I'd tell them all these things they have to do, and then I'd take re-x-rays, and they were never better. They were often worse mechanically. What do you do with that? You don't take re-x-rays. You don't tell the patient, you just take care of them, right? And it's more like a massage. And I was very frustrated. I was very angry. I wanted a refund from my school, and so I wanted to make a difference. So I was actually going to school to teach. I was going to teach high school physics because I'm pretty good at teaching. God made it that way. And so I thought, well, I can do that. And so I was almost done with my curriculum, and I was going to take a relicensing seminar. It would be my last one, and then I'd let my license go, and I'd become a teacher here in Clark County. And I went to a seminar with Burl and Sharon Petamon, and I didn't know who they were. But he was up front because, putting these x-rays down here's after, and they're getting better and better and better. And he's taking care of cases with MS, with polio, post-polio, with Parkinson's, with multiple failed back surgeries, scoliosis. And I literally stood up in the middle of the seminar and said, where have you been my whole career? Oh. And he talked to me afterwards. He spent about 3 hours with me because I was on the edge, about to jump. And he said, you're a good teacher. He says, you need to teach, but you need to teach this. You need to do this. And I said, no, there's no way I can do this. And he said, listen, you got into this business to help people that couldn't be helped. in a way that nobody else could help him. And I said, oh no, what'd you say that for? What'd you hit that button? That's my engine right there, you know? And so I said, well, there's no way I can do this. It's literally graduate level anatomy, physiology, graduate level neurology, engineering, calculus. I mean, it's a pretty sophisticated system. And he said, no, I'll be there every step of the way. And he's brutal. I mean, his affectionate nickname for me was Candy Ass. we were springing a spring so we could show what it looks like when a ligament gets damaged and what ligament slop and ligament instability looks like. And I had it in my hands. He was saying, okay, now I'm going to pull this. And he's about a 75-year-old man. And he rips it right out of my fingers. And he says, what are you, some kind of candy ass or something? And I said, obviously. If you could just slap me about the face and neck with that spring, we'll try it again. I'll wake up maybe. And so I started working with him, and in a short period of time, I wound up being an instructor for them. And then later, through a course of events, because when you're a Pedibond doctor, you wind up with the worst cases: multiple failed back surgeries, scoliosis. And most of my patients are saying, I've been to 10 doctors, I've been to 5 chiropractors. If you can't fix me, I'm going to blow my brains out.
I bet. Well, pain's it's a tough thing to deal with. I have a friend I was telling you before we got here who suffers some horrible migraines, and it kills me because my friend goes on a trip and her husband's in the cabin on a cruise ship half the vacation.
Right.
So I know he's maybe to that point sometimes where he's, you know, he's frustrated.
Yeah.
He served his country 22 years, retired Army, and he's stuck in bed because of massive headaches.
Yeah.
So that's the kind of cases you like.
In fact, most of the cases that come here, what they come in and say, I'm looking for a chiropractor, I say, Ken Hogan's down the street. And I use his name, I give him a card. I literally we'll call every once in a while. I'll have my staff call and say, we need another lug of your cards. Because you're not even ready for this. If you're going to waste my time, you're going to waste my x-rays. I'm about solving problems. And if you're just about getting a little symptoms, which is most of what America is used to, right? We're going to get rid of symptoms, Band-Aids, and say, hey, that's okay, but you don't do that here. We're about solving problems. And so we're moving along, and I really decided that I needed to know from the inside out, how did he develop the system? So I started reading all the books, all the references. I read the entire textbooks that he used to come up with this system. And it really created a different vision for me of how the system works, how it functions. And it allowed me to make the transition from being a cook and putting the system back together again to being a chef. And I started to come up with concepts, using the concepts, not violating the concepts that he taught, because they are true, but using those and modifying the way I apply them to get even better results, more profound results. Taking the scoliosis cases, that's a case that's a 45-degree Cobb angle, and making it a 3.
Wow.
And so you take and put that system back together in a new way, and it's something new. And I started to become very, very confident in the results, particularly within scoliosis. So I started doing a lot of work with scoliosis, and I started writing research. And I met my partner. It was very interesting because we were both coming up with the same concept at the same time. And then we met because we were both on the board at Pedibond, and we developed what's called ARC 3D Systems, which is taking the advanced model that we came up with Pedibond system and applying it to scoliosis, because there are specific things that you have to address. And then from there, we literally turned it back on all the patients, because it truly works more profoundly. It gets you closer to that normal, to where it's near spec, the way God intended it to function. And so I because of the research that we were doing, it became very apparent that I needed some skills that I didn't have, and some understanding that I didn't have. Medicine is about 30 to 40 years behind neuroscience.
I believe that for sure.
It's really sad because the information is available. It's there. If you want to know, it's available, and they don't avail themselves. In fact, many of the things that I do on the neurology side are things that we have taken from their research, from the medical side research, specific therapies that are targeting different areas of the brain. And like many of them are developed at Harvard. Well, you can imagine that, you got a way to stimulate cranial nerve 10. And the way the medical community likes to do that is they have to cut into your neck and attach electrodes to your neck. And you've got a pack in your pec muscle. They say, well, we do it with an ear clippy and a TENS unit.
Yeah. Well, I was going to say that, or just a simple back vibrator, put it on there. That's amazing. As soon as you mentioned 10, it's 7, 9, 10. And then I attended one of your classes and Lenny was speaking and he was a little scratchy, which I've been a little scratchy. I have to go to the doctor coming up. But Dr. Elmer had put like a back massager, like right here in his neck to stimulate number 10. Yeah. Right. Because I've been going to the classes, stimulate number 10. And then Lenny's voice was better, and it was simple.
Yeah, and all we're doing is just backing in. We're sending a signal into the glossopharyngeal and to the vagus nerves, and particularly that glossopharyngeal has to do with that voice down deep in your throat. And cranial nerve 5, it's mostly sensory, but there's a motor part. Those arches in the back, the pharyngeal arches. It has to do with that. And so I had a patient that had she had a scoliosis, but she had trouble speaking. She had trouble with the S's and the A's. And you develop that whole chain through breastfeeding. And cranial nerve 5, 7, 9, and 10, I got to pull the food in. 5, 7, I got to move my facial muscles. 7, cranial nerve 9, I got to swallow it. And then cranial nerve 10, I got to do something with it. Now I got to digest with it. That whole chain grows together. Well, she had trouble with that portion, particularly cranial nerve 5. And so I had her sucking on a sucker. And within 2 weeks, she sounded like an adult. And her mom came in a week later and said, "What'd you do?" And I said, "Sucker therapy." we use those for a more adult mouth. We use the blow pops. For the more pediatric ones, where we use the Tootsie Pops. And then for little dum-dums, like my little grandsons, I pull on their little dum-dums as they're pulling, and they'll start to teeth it. And I say, no, goldfish face. And they'll do it. And then once I can see that they tire, they fatigue, that's really the key to understanding what you're doing. It's not just that you do the right thing at the right time, in the right place, but more importantly, you know when to stop.
Yeah, it's a lot of it's getting back to the basics with the work that you do. Crawling is such a key component in a baby's life to do that crawling motion. I've seen videos when you come to visit Dr. Elmer, he's got a video, shows a girl with cerebral palsy. And she was about 12, I would say, when she finally went to the functional neurologist. Mm-hmm. And the very first thing he did was put her on the floor and had her crawl. And it just goes, then it started from there. I also have to say is I came into Dr. Elmer's office one day, I believe for the class, I'm not for sure, an appointment, I forget what it was. And I had spoke to this lady off to the side, and her husband was walking and talking. He was a tall gentleman. I believe he was from church, and he had a stroke, and he wasn't speaking. And he was in a wheelchair, and his poor wife, it was just a lot. You could tell she was tired. She was dealing with this man. He was very, very tall. They had a 2-story home. So all these things. And I walk in and she was in tears because he was walking and talking. So, and a lot of it's back to the basics of work. Dr. Elmer uses a lot of tuning fork work, vibrational work, glasses, the color glasses, which you should have brought a couple pairs over here to show you about the glasses he uses. What are some good tips? Because I know a lot of my audience is a little bit on the older side, our age. And I know dementia, Parkinson's, and Alzheimer's are 3 things that everybody is afraid of. What are some tips you can give for people if they think that they're suffering from that?
Yeah. Well, the thing that precipitates those three, is the posture degrading.
Oh, see, I got to sit up. I forget. I'm with Dr. Elmer.
But if you have to think about it, you're doing it wrong, because it's an involuntary system. In fact, I'm doing a series of videos on biomechanics, but then I'm going to be doing a series of videos on YouTube on the extrapyramidal nervous system, which is the nervous system that thinks you don't think it. And so that posture, as you're a baby, you're in the flexion position. Everything is flexion. I remember when I put my oldest son on the table for the first time to change his diaper, and his arms didn't flop onto the table. They stayed off the table. And wow, that's really unique. I expected his arms and his legs to flop onto the floor, but now I know it's because of the tone of the flexor muscles that kept in that position. He's got to grow. We call it the posterior compartment, which is all of the stuff that makes it so that you can stand up. Well, that creates your adult brain. And so things like crawling are vital to create that posterior compartment. And you think, well, all you have to do is just a little bit. Are you kidding? How long does it take kids? How long does it take them to actually develop? It takes as long as it takes, and it could take years. And if they don't get that right amount of crawling that they need, then they have to go back. Otherwise, they're on a downhill slide. So that anterior compartment is winning. It was there before you were born. So you're not gonna beat it. But you want to spend your whole life in that upright position without you having to think about it. And that's the essence of the pedibond system. We put the weight on the forehead, it pulls forward, and you don't even realize you're pulling back against it. Mm-hmm. It plays right into that I call it the front door to the extrapyramidal nervous system. You can do things like yoga and that, but you're going to have to go beyond 45 seconds, because as soon as you pull back, that's voluntary. Okay. That's the voluntary pyramidal nervous system with the type 2, the fast twitch phasics. That's the stuff you do at the gym. That's a voluntary system. And so spending time, upward dogs, which is more of a stretch, cobras, but you're going to want to go beyond 45 seconds, because that's going to start, the voluntary nervous system is going to start pooping out, and the involuntary nervous system is going to be the thing that's left. That's I call it the backdoor approach to the extrapyramidal nervous system. But when those nerves don't do their job, they come up, I call it cellular mischief. Inside those cells, if they don't have something to do, well, you got kids. Mm-hmm. If you don't know where they are, they're in mischief, or they're quiet. They're likely in mischief. Exactly. I know I was. When grandma was looking for me, she knew it was quiet. I'm into something, and she better find me and get me back to work usually in the garden. And she was right. Well, the cells start creating mischief, and it's according to which genetic code you tend to have. In my family, I would tend to, with that cellular mischief, create a protein that I can't get rid of called synuclear proteins, which means I'm predisposed to Parkinson's. Well, my grandfather had it severely. I didn't really know him. I had met him a few times before he passed, but he was like he was in a shell. Mm-hmm. Well, that's that cellular mischief that was locking down that nervous system, and he couldn't express. He was all locked up and frozen, and he couldn't express the limbic side, which is really your personality, who you really are, and that. But if my genetic code says I'm going to have Lewy bodies, then I'm going to tend towards frontotemporal demise, which is dementia. If it tends to tau proteins, I'm going to tend towards Alzheimer's, which is a frontal. The Lewy body problem and the frontotemporal demise is going to give you more of an explosiveness, whereas the people who get Alzheimer's, they tend to get frustrated because they know they've forgotten and they know they're lost and they're confused, but they're not immediately explosive. They're more frustrated. Parkinson's, we call it a movement disorder. I say from neuroscience, we say it is a brain degenerative disorder with a movement disorder inside of it.
Why do you think it seems like more and more younger people are getting Parkinson's? I've been reading more and more. Mm-hmm. Why do you think that is?
Two major factors. One, medications and illicit drugs. And number two, they don't develop their posture.
Really?
They don't wind up crawling around for very long. And I've had many moms that come in and I say they didn't crawl enough or they didn't breastfeed enough. I tried it. Relax. This is not an indictment on you, Mom. They just need more. We just need to get them on the floor and get them crawling around. We need them to suck on a sucker to develop that chain, whatever it is we need to do. And because we have swings, Johnny jump ups, walkers. Walkers are illegal in Canada. We can't even get them in Canada, but here we can. And so many of the things that we do to create an environment that is conducive to not developing the system. And that's what autism is, and the learning disorders, which are on opposite sides of the brain, they are a lack of development of those systems in the brain, and they need to fully develop. And the things that we do for it traditionally, which tradition now is medicine.
Yeah, which is a shame.
They're not going to address the real problem. In fact, they're going to create a problem that they didn't have in the first place.
Yeah, Dr. Elmer does do work with autistic patients, stroke, Alzheimer's, Parkinson's, dementia. He also, I know one of his loves is TBI, traumatic brain injury. That's one of his specialties. He really, really likes that. So tell us a little bit about what happens when a brain is, say, just in a bad car accident. What happens?
Yeah, and it doesn't even take a bad car accident. I've been in depositions and listened to these, especially attorneys and insurance companies, as they talk about it. And I actually have a video footage of a fresh brain. What does it look like? If you take a fresh brain right out of the skull and put it in a bowl, it assumes the shape of the bowl. And on this video, literally as you take it in your hands and you're trying to be very careful, it's tearing the corpus callosum, which is the connection between two sides. As you're trying to be gentle with it, it's more like tofu. And so when somebody says, "Well, it probably didn't get hurt," or he didn't get injured, say, "Well, that's funny, but let's get real here, because it's not a problem with the helmets. It's a problem with the physics." And the physics of the matter is that these gentle tissues are very susceptible to injury. Inside, we call it the cranial vault, and that it has sharp edges in there. And they run in and they get hammered. They resonate at different frequencies. We always talk about what we call the contra-coup injury, where I'm going forward and then back, and as I'm coming back, it slams the brain against the front, and then I do the same on the back. Actually, it's more sophisticated than that. It's like an upside down pendulum. As it goes forward, different parts of the brain are going at different rates. And so the gray matter, which is a bunch of cells, is getting rocketed against the white matter, which is the connections. They're the axons here. So it literally can shear entire areas of those nerve cell bodies away from their axons. We call that diffuse axonal shear. And so when that happens, it can damage an entire area of the brain, and likely it's not even going to show it. You're going to have to do things like brain mapping in order to find that. And nobody wants to do that, because then it would show you actually got hurt. You say, well, and then you go into a deposition related to that. Well, you have no proof that, well, the guy was an executive and now he can't do it. You say, well, he lost his sense of smell. Well, 94% of those who lose their sense of smell from a brain injury, they'll never do what they did before, because it's that bad. And so, and we see all kinds of different situations with professional athletes and with people who've been in car accidents and particularly car accidents that have been misdiagnosed. The problem that I see is it's like the opioid epidemic here. Nobody knows, nobody really understands that taking away the opioids from the patients it's not a painkiller. Mm-hmm. It's a suffering killer. It works on the limbic brain. And so you could have a pain of a 10 and a suffering of a 10, and you take an opioid, and now I've got a pain of an 8 and I've got a suffering of a 2. And it's also beating back the immune system. And most of those patients that are being taken off are going to get a new problem that they weren't dealing with. Most of them have an autoimmune they don't even know about.
That's another thing I wanted to talk about. autoimmune is such a big term right now. Explain what autoimmune is, and I think you have a very strong opinion on autoimmune about with children. So, well, explain what autoimmune is. Because it's more and more. It seems like it's happening more and more.
Yeah. Let's talk about what the immune system is about. We always say that the immune system is really about killing the bad stuff. Okay, it does that. But more importantly, it actually causes you to have the highest efficiency of the physiology that you got going on. If you've got junk gathering around the cells or inside of the cells, it's becoming less efficient. It's kind of like on a work. I used to work when I was a kid. I went around to homes where they were building and say, hey, I'll sweep and pull the big stuff out right now, and then I'll come back around at the end of the day and sweep it out. I was allowing them to operate at a higher level because they weren't stumbling over stuff. Well, the physiology, when it backs up, decreases, and it keeps getting worse and worse. That's what the immune system. Plus, there's more stuff that's in your body that isn't you than is you. And we have a symbiotic relationship. And we need them and they need us. And we want to create a win-win. If it becomes a win-win, a win-lose, where I'm losing, I'm in trouble. But also, if they lose and I win, it's a problem. Because now I'm not getting that synergistic impact from the immune system. From the stuff that's in me. So that's what the immune system is about. But let's say the doctor grabs your head as you're being born and turns it and extends and pulls you out, effectively giving your first injury to your spine, causing that area which governs, it's the governing system of the immune system and the hormonal systems. Now they're not going to function nearly as they should. At first, they start getting colic, croup, they start getting sore throats, and then after a while, the brain says, this is not going to work. We're going to die. So it jacks up the immune system, and as it jacks it up, now I'm not getting sick anymore. I'm doing all right. And everything seems okay. We don't have to do doctor visits. I'm not getting my earaches anymore. Don't have to put any of those tubes in or whatever. And then later down the road, you notice, I got clear stuff out of my nose and out of my eyes. And whenever the pollen's in, I'm really having a problem. That's because it's jacked up and the nervous system doesn't know what it can trust. And so it basically gets greater and greater insensitivities to the outside world because I don't know what I can trust. And as it gets worse, there are fewer things. Now I can eat fewer things because every time I eat, oh my gosh, it just tears me up. So I'm eating bland foods now and fewer foods, that are options, until eventually I wind up with a problem that I no longer am tolerant of my own tissue. And that means my immune system is turned on itself and I'm attacking myself. And what the medical community says, he says, oh yeah, you've got Hashimoto's. I say, no, you have autoimmune. It's giving symptoms of Hashimoto's, which is autoimmune thyroid. It's attacking everything. Whatever succumbs is what you have, right? What we give you the number for. They say, okay, well, we got to do some steroids to knock down the inflammation. Yeah, but that's the current inflammation. It's not going to fix it. What do we do in order to get the immune system to stop attacking you, to be nice, to play nice? It needs to do its job, but it needs to do it within its parameters. And so then we wind up, seeing, well, okay, we've got steroids, we can do that, but now I've got another autoimmune, and they're astonished. You have lupus too. Why are they astonished? You just have autoimmune, and you're getting symptoms now from the connective tissue, and we call it systemic lupus erythematosus. So, well, okay. When you look at it at the end of the day, it's either a Th1 or a Th2 problem. You either have a cellular response problem, which is attacking you, which is the T regulators, T killers, T chemotoxics, the T suppressors, or you have a B cell antibody response problem. One of them is attacking you. If the B cell is attacking you and tagging everything, then the cellular response goes after it, but it was precipitated by that. We've got a high B cell. If we look at it like a teeter-totter, right? Th1, Th2, and you say if one is high, if the antibody response is high, we've got to work with botanicals to get it to level out so we don't attack ourselves anymore. That's the way to solve the problem.
So
That's the way
can
to
you
take
get
care of it.
tested for that? Can you get tested to see for the?
Testing is so insensitive, and it's very expensive.
Yes, it is.
You're a much more sensitive machine than their lab work, right? Think of lab work. If you think of lab work like, think of the blood system like the freeway system. If you look at the freeway system and you say, wow, okay, that's everything that's going on in my body. No, it isn't. It's the transit system for everything that's going in the economy in that body, in that human body. It's a pulse, right, of what's going on in the communities, the economy that's happening in the communities. So you have to look at it more like that. When the medical community looks at it, they say, oh, look, this is up. That means, no, I got to take it with everything else that's going on in the system. Say, well, he doesn't have an autoimmune. How do you know? Well, it didn't show up. By the time it shows up in the lab work, you've had it bad for a long time. What would an autoimmune look like? Autoimmune would look like inflammation throughout the entire body. All of a sudden, it gets bad. Why? Particularly summers are always bad.
Sure.
Summers, it gets really bad. Why? Inflammation. Hear it?
Inflammation. That's one thing I always tell, with the oils, somebody will ask me a question about the oils. And the very first place I go is inflammation.
Yeah.
It sounds like inflammation because that's a lot of times where the pain comes from.
Yeah.
Dr. Elmer was at when we did this Lunch and Learn, and he gave some really good tips on basic brain work. And one of them was doing the opposite. So I'm left-handed, which I know from Dr. Elmer, only 5% of women are left-handed, 30% of men. I've learned that from Dr. Elmer. But I've been brushing my teeth with my right hand because of Dr. Elmer, which is it's not difficult, but a little bit weird for me. And now I know why the dentist always says something about this side of my mouth, because I know I'm brushing too hard. But another good tip he had given was like one of those balance balls with the board. Left-right brain work is key. And so just get like one of those bouncy, not a bouncy ball, but it looks like a Saturn. And then just, stand on that. My daughter, I was telling her about that work. And she said when she played softball, that's how their coach made them stand on base. They would stand on the board and catch the ball and didn't even realize they're on the board because they were catching the ball. And she was like, oh, Coach Streets used to tell us that all the time. So I'm really grateful to Coach Streets for doing that. Yeah, what a great drill.
High tech. That's very
high tech and in a low way. Yeah. It's not like we do need some expensive equipment. Don't get me wrong. But if I ever showed you Dr. Elmer's office, it's very basic. He uses oils in his work. I was in a class one day where a woman hadn't smelled for 10 years. And I believe he used a tuning fork with her, the vibrational neck vibrator or back vibrator, and then oils. And then we sent her home with oils, hoping that she's using her oils, Elta, to, help stimulate that sense of smell. So what are some good tips for people? Oh, and keep moving. That is the one thing, is if you don't move it, you will lose it. Yeah. Absolutely. So give some good tips of a few things that we can let people go home with today to work on some good brain health.
I say anybody over 40, you're not there yet, but anybody over 40, I say you need a muscle building program, because the muscles house within them what we call muscle spinofibers. They're the primary drivers of the brain. When you get up in the morning, you can't think, you can't smell, you can't taste, you can't do anything. And then you stand up, and as you stand up, gravity pulls down on your structure, pulls on the muscles, and those little receptors inside the muscles send signals up to the cerebellum, and they turn on the opposite cortex. And so the greater the tone that you can maintain within the muscles, the greater the muscle mass you can maintain, the younger you're going to stay, not just in terms of your physical body, but more importantly with respect to your brain. Anybody over 50 is in desperate need of a balance program, meaning you're going to need to set up a balance gym in your home. It's really easy to do, really inexpensive. They call me the MacGyver of chiropractic. You take a walker, an old cheap walker that you're never going to use, you back it into a corner. Now you have, if you fall back in the corner. If you fall forward, you have a cage. and you set it at your height for your arms, and then you're going to use different kinds of equipment, like just a foam pad. I mean, you can do nothing, just stand on one foot and then on the other, and the side you're not good at, you progressively get better and better at it. Then you're going to increase by using foam pads or rocker boards, and then you'll progress that from rocker boards to wobble boards, and then you can get into some very sophisticated balance equipment. We have some equipment here that was, our posture med system is literally from the East German Olympic athlete program. And it doesn't look like much, but it does a whole lot. We've had people come in here with severe balance disorders, and I put them on that. They say, "Oh, there's no way I can stand on here." I said, "Wait a minute. You think that this is about testing you. This is actually going to help you right now." And so I put a weight on their forehead, put them on the pad, and I put them on the plate, and all of a sudden they could stand better. And they said, "Well, why didn't they do that at the UCLA?" And I said, "Why don't you go ask them?" This isn't my technology. This is from other people. And so that balance system ignites a very large area of your brain. And people always ask me, how do I keep my memory? Well, that working memory is in Robin's area 4, 6, and 8. It's all the balance system, movement system, but the more profound area is what we call the supplementary motor area, which is about stabilization. Mm-hmm. And so I want to stabilize. So I have a trampoline, a little trampoline that I just pull out and put down, and I bounce on it for just a little bit, but then I'm bouncing at odd angles to force myself to have to stand up and to restore my balance. And so that is much more profound because it ignites those stabilizer areas, and that's the working memory. Think of it like the RAM on your computer. The amount of RAM on your computer determines how much am I going to be able to do. Can I get into other programs and get them out? And that, well, that's your RAM up there in that area. And so we want to get that area to ignite. Eye movements, particularly upward eye movements. We do not look up at all. We're going backwards. We're becoming kids. When mom put us on the hip, right? It was sort of, and we were developing the tone of the muscles in our back, but also the movements of the eyes and the connection between the individual strap muscles of the eye with individual muscles within. I'm doing a video series on this, on the biomechanics of the spine, and I'm going to relate it to the neurology and how it connects up the lateral eye movements, connects into specific lateral muscle systems, and then it starts. After that, you're going to get the Army Man crawl, which is a side-to-side system. Well, we're losing the ability to look up, and when we try to look up, we're not going very far, right? And so looking up. There are two demographics that don't get Alzheimer's. Who are they?
Oh, I know this because I've been to the classes. Asians, and the Jewish community, because
and the American Jews.
Because see, I do listen.
Yeah, you do.
Because they
you
read
well.
right to left in the Quran. Yeah. But you just said something before that really makes me a little nervous about not looking around. We have these children playing video games, looking at iPads. That is concerning to me. And I've been worried about it for my son as well, because they are here. Yeah. They're not being aware of their surroundings. Yeah. It's like a tunnel vision society we are creating.
Yeah, we're creating the mess that we're in. The amount of autism that we have has gone up 2,000%.
Wow.
2,000% in 10 years.
That's very scary.
Yeah. If the current rate gives the way it is, we're going to have, right now it's at 1 in 38 are autistic. If the current rate is going to be 1 in 2 by 2025.
That is so scary. So is it true that it predominantly manifests in boys versus girls?
Oh, yes. Yeah.
Really?
Yeah. Yeah, I think that happens because this is like a revelation. Guys are different than girls. I don't know that I'm probably going to get shot for saying something like that, because obviously
we won't shoot you.
Yeah, I'm not PC. Sorry, man. I'm going to tell it like I see it. But in terms of the environment that we've created, it makes it very difficult for anybody to grow their brains, much less a boy, because the boy doesn't have the same thickness and density of the corpus callosum, which is the connection between the two sides. And so he's got to work so much harder than a girl does. In terms of making the brain, we start off as a right brain. In neuroscience, the right brain is the we call it the brake pedal. In neuroscience, we call it the system that's going to protect us, and so it's got the neuroimmune system connected to it. Whereas on the left side, that's the gas pedal, and it's going to connect to the hormonal system. So it's more of a limbic and hormonal output and that. And we tend, when we're first born, it's all about survival. If we don't get it right, we're going to die. We call that SIDS, right? And so as we develop, we're all right brain, and then about 12 to 18 months, we transition, because we got this now. We're not going to die.
Yeah.
And we transition to the left, and what do we start developing? Well, we're toddlers, and we start to develop the ability to crawl and to move and to stand up and to walk, and develop the use of our hands. And about the time we can take a spoon and guide it from the plate into our mouth, we have enough brain real estate to talk. But all of our speech centers are always on the left. Why? Because that's the brain we were developing when it happened. And so the speech centers are on the left. But then we're going to transition back to the right and start developing it about the time we go to school. When we go to school, we should be doing things like the arts. We should be doing things like recess and PE and that. And we go into the classroom and we sit down, and I need to move. I particularly need to move the left side of my body so that I can develop my right brain. I need to develop my left cerebellum and my right cortex. And about that time, I'm told, if you move, you're a problem, and we're going to drug you. And I'm told too, if I come up with right brain solutions, I'm going to be penalized. If I come up with left brain solutions, I'm incentivized. Can you see the conundrum?
Yeah.
So I become all left brain because it's survival. I don't survive outside that world. Well, I'm already good at it.
Yeah.
It's what I've been developing for a lot of time. And so we create this left brainer that has no social skills, no ability to control their emotions, no ability to truly control their attention systems. That is autism.
Yeah. Yeah.
And so we created that monster, and we've gone from, because we're so dead set on not only this is the model, which is old. I mean, it's 30 years old now. I mean, I've heard doctors quote stuff that is like archaic, dig it up from the pyramids, and they are the experts. And I just laugh out loud. I say, ask them whenever you talk to your expert, your doctor, say, have you ever heard of Autism 1? And watch the stare in their face. Autism 1 is the group of researchers they are the top researchers in the world. They have 3 Nobel laureates. Say, that's where I get my information. I don't get it from the local community. They have no idea what they're talking about. And so we've got to change. If we're going to beat this thing, we have to change entirely how we do things. We don't let kids go out and play. We don't allow them to get up and move. We don't allow them to express themselves. We don't allow them to make mistakes. We don't allow them to be right brain. And because of that is our autism problem in a nutshell.
That's scary. I heard this a while back. I don't know how true it is. I did look it up. I don't know the source. But there's, my son, our grandchildren, they're known as Gen Z. They are predicted to be the first generation not to outlive their parents. Huh. So I found that very interesting. I don't know if it's because of the non-movement or the environment or whatever the case may be. I want to thank Dr. Elmer so much for today. I really, really hope that you come and see his classes on Wednesday. They're at 6:30 here at the office. And let me grab his card so I can give you the address. It's 3505, and I will post in the comments, East Flamingo Road, Suite 4. I have attended a few of these classes, and like I said, I met him at Lunch and Learn probably around January I'm going to say, but from January to now, the growth has been amazing. The confidence. I was laughing, joking with him because he coaches his clients. This is the way that it is. If you don't like what I'm doing, then you need to find somebody else because he's way too busy for what he's doing. He's doing amazing, amazing work. I'm so happy that you all logged on. Please reach out to Dr. Elmer anytime. Wednesday, 6:30 here in East Flamingo. It's right here at East Flamingo and Pecos by that. Looks like an old graveyard of like older carnival things. That's
the Amazing
right.
Clown Store.
The Amazing Clown Store.
Behind that.
He's behind that. So please come and join his class.
Which says a lot about us.
It does. It is like a class. It's like a circus in here. But he does give some amazing tips. There's one of the classes I was going to talk to Dr. Elmer about coming up is I work with a lot of veterans. And one of the biggest issues, he already knows what I'm going to say, is PTSD. And why don't we just touch on that just a little bit before we go? And if you don't, would you mind sharing your story about your son?
About my son, yeah. Let me just say about PTSD, because we always think of it as this massive disorder, and it creates all kinds of havoc. But from a neuroscience point of view, imagine that your brain wires to wherever you live. You move somewhere. Let's say you move to another town. At first, it's very difficult, and you're having trouble getting along, getting places, remembering where you're supposed to be, and you have this feeling of frustration and angst and that, and so it's very, very challenging. And then all of a sudden, it gets easier. You have just wired to that place from a neurological point of view. Well, my son was in Iraq for 2 different tours, but on the first one that was in Ramadi, it was very, very difficult. But imagine, here's a kid who is very, very adept as a warrior. He would get called on all kinds of ops. He had Delta Force.
Well, he's very tall and big.
He's 6'5", 240 pounds at the time. And he's a martial artist, and he can get it done. And so on this base of Marines, he was always the one they picked to go knock down the doors.
Yeah.
But also Delta wanted to recruit him, but he was too young, to get in that program. But imagine he was wired as a warrior. He knows that environment. He's good at that environment. Imagine PTSD as you come home and you cannot unwire from war and wire to home, because there's an area within your brain that allows you to make meaning and to change things. It's called the insular cortex. It's five basic parts of the nervous system. You got one on each side, and whichever one is not functioning doesn't allow you to unwire and to rewire to your new environment. I mean, this happens just as bad for a young lady who winds up getting raped, or a man who loses his career. It's just same kind of problem. And now I can't unwire and wire to the new circumstance. And so turning that area on and making the new meaning. And my son had a very bad situation happen to him, and something that he had to do, and it was very, very difficult for him to deal with. Well, my job is to turn the insular cortex on so that he can sit with a counselor and make new meaning of it, that it means something new. Mm-hmm. But if it's not turned on, you can't.
So he can help turn it on. And that's one of the things, one of the classes coming up, I was going to ask Dr. Elmer if we can, when he come in, it's usually about what everybody wants to talk about. But I was going to ask him coming up to do a class on PTSD for my friends. And I have some friends, I have some soldiers. So I want to thank you so much for being on here. Thank you, Dr. Elmer. I really appreciate it. Thank you, everybody in Facebook. If you find value in Dr. Elmer and what he's saying and his thoughts, please share. Do that right-left brain work. Brush your teeth with the opposite hand today or this evening when you get home. Maybe stand in a corner on back to a wall and put your foot and try to balance. I know I'm going to work on these things, and I appreciate you where you talked about physical health, because that's one of the things I know I need to work on is more physical strength. So I'm definitely going to do that for myself because I'm not over 50 yet. So have a great day, everybody.
Bye.
Good job, Dr. Elmer.